It has been going on for 60 years, moving mentally ill people from state institutions and into the community for treatment. We've seen what happens in some recent cases where a mentally ill person is shot by police. But if the system to help the mentally ill has been broken for so long, can it be fixed? 10 on Your Side's Brandy Cummings spent months investigating the problem and the debate surrounding it. Brandy?
Anita, everyone has their opinion on how to go about this, and there's not just one answer. Some local police departments are at least getting some specialized training on how to handle mentally ill people when seconds count. The problem, it's not happening for all officers. It's a national crisis, one leaving a growing burden on our community.
It is a stressful and a very tense situation, and they have moments, only moments and seconds to gauge whether or not that person is a threat to them or a threat to themselves.
Stephanie Boland is a Norfolk-based attorney representing two families who've had loved ones with diagnosed mental illness killed by police in Hampton Roads. She calls what has become the policing of the mentally ill a problem.
You're talking about families who are affected, not just someone who is being defiant.
An analysis done by the Washington Post last year uncovered of the nearly 1,000 police shooting deaths across the country, nearly 30% of the victims had a mental illness.
It's just not seen as a priority.
Myra Singer is the Virginia State Executive Director of NAMI, the National Alliance on Mental Illness. She says the predominant way of thinking many years ago was that people diagnosed with a mental illness should be in an institution. 10 on Your Side uncovered this New York Times article published in 1984. It calls the release of mentally ill patients from the hospital to the community a failure.
It's a very good theory, but you have to have the tangible services and the funding and the resources and the staffing. And unfortunately, what happened was that push towards deinstitutionalization became a money saver.
A savings that's now costing taxpayers. Police now not only handle public safety, they have become community caretakers. In some cases, first to be called in a mental health emergency.
It's the ultimate tragedy because something probably could have been done before it got to that point.
We don't necessarily want it, but we accept the responsibility to do this because it's part of the job.
Lieutenant Johnny Gandy is a 29-year veteran Virginia Beach police officer. He admits sometimes police have gotten it wrong.
In the past, we haven't really did a good job of recognizing the fact that it was mental illness versus some type of behavioral born thing, some type of criminal act.
And that's where we're kind of living in an imperfect reality, so to speak, with police officers being the ones who are the first line of defense, and our organization and lots of other advocates feeling that if they are going to be the ones who are the first line of defense, then they need training.
A common training used by police forces across the Commonwealth is called CIT, or Crisis Intervention Team Training. It's a 40-hour course that in most jurisdictions is voluntary. Lieutenant Gandy worked to get the first set of Virginia Beach officers trained in 2008.
It affects so many segments of society. Unfortunately, when it becomes that crisis situation, it seems to be a police issue alone.
Everyone we spoke to can agree training is not the only answer to this complex problem.
We have to build more hospitals. We have to have more doctors, more staff to be able to take care of people.
Singer also has a long list of things she believes could make a difference for people with mental illness.
Mobile crisis teams, housing, jail diversion programs, having immediate same-day access to appointments so that people don't have to wait.
Meanwhile, Boland wants to see mandatory training for all officers and a written protocol for every law enforcement agency across the state so no one else has to die because of a mental health misunderstanding.
Because you're talking about people's lives.
Lieutenant Gandy says families can help police by making sure loved ones with mental illness get treatment, go to their appointments, and take their medication. Now, if there is ever a crisis and you do have to call police, be very clear about your loved one's illness so police know exactly who to dispatch. We have lots of resources for families on our website, wavy.com. I'm Brandy Cummings, 10 on Your Side.